观众朋友们，大家好，欢迎您收看今天的健康1+1节目。在生活繁忙的今天，人们整天就是工作、家庭，真的是蜡烛两头烧。即使知道健康的重要，却总是无意中忽略了。等到发现的时候，可能已经到了很难以挽救的地步。如果这种情况不幸发生，我们应该怎么样对待呢？在本期的节目中，我们将帮助晚期前列腺癌病患了解晚期前列腺癌的常见症状、治疗方法、养护措施以及克服心理障碍的方法。首先呢，我们先了解一下晚期前列腺癌的一些常见症状和前列腺癌患者的心理表现。一般情况下，晚期前列腺癌病人会出现排尿障碍，80%的病人会有排尿困难、尿分叉以及尿程延长、尿频、尿急、尿痛、尿液不尽等症状，而且转移症状是常见的，多发生在骨骼内外、腰部以及腹股沟等部位，引起相应部位的淋巴结肿大以及下肢肿胀。
Advanced prostate cancer is really cancer that has spread from the prostate in your pelvis to other parts of the body. The most common symptoms of advanced prostate cancer are bone pain, and that's because prostate cancer most commonly goes to bone in about 90% of patients who have advanced prostate cancer.
由于癌转移出现的疼痛，腰部、臀部、髋部疼痛、骨盆、坐骨神经痛是常见的症状，剧痛难忍。由于疼痛影响饮食、睡眠和精神，长期的折磨会使全身状况日渐虚弱、消瘦乏力，甚至导致进行性贫血、恶病质以及肾功能衰竭。对于不同文化背景的任何人，当听到你得了癌症时，心理上肯定会感到压力，想到死亡和对死亡的恐惧。很多情况下，当男士面对前列腺癌时，也会有类似的情况。
I was in the middle of two very important professional projects for me, and I went to a urologist. He performed an examination and isolated and requested a biopsy.Actually, and the biopsy came back positive for cancer. It was prostate cancer. I was stunned and sad and anxious. Everything on the surface may have looked normal, but I knew that inside I was definitely going through changes. And it was frightening to me, honestly. There was a lot of anxiety and fear.Men
carry a heavy burden, almost across all cultures, of being the one to take care of family. So the last thing they want to do is burden family with their own concerns as well. And oftentimes they don't have the strength or the wherewithal to continue their financial contributions. So within that, the psychological stress for patients especially isn't just about the cancer.About mortality, about pain, about relationships with their doctors. It's also about not being able to work, about what's going to happen to the family if they can't provide, about all of those other issues.
前列腺癌跟肺癌啊、肝癌啊，确实有一点不同，因为我们知道前列腺是男性的一个生殖器，病患者呢在性功能方面会受到影响，而且呢，他本身的病会比较痛。那他的痛也会影响他的情绪。
在对前列腺癌患者的心理状况和对晚期前列腺癌的常见症状了解后，我们将给大家介绍的是治疗方法。首先，准确的诊断可以帮助医生找出最佳的治疗方案。那么，目前对于晚期前列腺癌的诊断方法都有哪些呢
For early prostate cancer, we know that blood tests like PSA may detect the cancer early, and those patients may be treated with treatments like surgery or radiation. But once prostate cancer spreads beyond the prostate, tests like PSA are not enough. You need to assess whether or not the cancer has spread to other parts of the body. And those tests include a test called the bone scan, where we look at the entire body's bones because prostate cancer commonly goes to bone in about 90% of cases. We also do something called a CAT scan of the abdomen and pelvis, and the CAT scan would look for other sites where cancer can spread, including the lymph nodes and the liver and possibly the lungs. Those tests help us to know where the cancer is and also help us to know what the best treatments might be for advanced prostate cancer.
另一个检测手法就是肛门指诊，检查者戴上手套，涂上润滑剂，将手指伸入肛门内的直肠检查前列腺的大小形状与质地，形状不规则，质地硬或软，可能是肿瘤，需进一步检查。这个检查只检查前列腺的背面，不过85%前列腺癌是发生在此区，能在肛门指检中摸出来的癌症通常更为严重。
Most men don't want a prostate exam. You know, it's not a pleasant experience to go to your doctor's office and to have the doctor do a digital exam of your prostate. On the other hand, it's a very simple test, and it can pick up a cancer really early. So in general, it's after the age of 50, you should consider having a regular examination, a physical examination that includes a digital rectal exam.
现在的医疗技术与设备日新月异，20世纪的医学进步更是令人惊叹。为了治疗癌症这种可怕的疾病，全球的医学家致力于抗癌研究，在治疗晚期前列腺癌方面出现了许多新的有效的治疗方法。目前临床证明有效的治疗方法又有哪些呢？
So one of the exciting things of the past few years is that there are many new treatments for advanced prostate cancer. When I started in this field 15 years ago, there were very few things we could do beyond first-line hormonal therapy. But in the last 3 to 4 years, we have 6 new treatments that have really made it very exciting for us as doctors to be able to help our patients. We have a very interesting and exciting new treatment called radium-223 that specifically goes to the bone and helps to alleviate symptoms of cancer in the bone. What it seems to do is it goes directly to the bone and seems to kill cancer cells in the bone. And patients who receive this treatment, which has very few side effects, seem to live longer and have a better quality of life.
因为疼痛是晚期前列腺癌可怕的症状，靶向疗法雷223的出现，大大的延缓了或阻止了癌细胞进入骨头后造成的疼痛，同时延长了患者的生命。除此之外，生物疗法与免疫疗法在对抗癌细胞方面也起到了很好的作用。
When we use the word biotherapy, it means biological treatment. It means drugs that may, for example, directly target the cancer cell and kill the cancer cell by a smarter method than drugs like chemotherapy, which kill any cell that's growing quickly. The most important targeted therapy that I would say that's available to patients are hormone treatments. We have a new category of hormone treatments, drugs that block the male hormone and shrink the cancer and actually have a very good effect in patients with advanced prostate cancer. And so a very exciting area of research in the last few years has been the development of immunotherapy or immune treatments to fight cancer. The first immunotherapy was actually developed in prostate cancer. A drug takes the body's own immune cells, they're filtered, they're made smarter by putting in a protein that makes the person's own immune cells kind of recognize the cancer, and those cells are put back into the person's body, and then they go and we believe they kill the cancer cells. And that's been FDA approved and is available to patients with advanced prostate cancer. So the good news about prostate cancer is that there are many new treatments and we're keeping men alive longer with better quality of life.
在进行有效医疗方法的同时，现代医学也越来越发现一个事实，就是精神因素对于病人身体在抵抗疾病的能力上有着很大的帮助。除了药物疗法， 心理疗法也是非常有作用的，对晚期前列腺癌病患显得更加的突出。在美国，社工会是一个大型的专业的心理服务机构，这个团队中有专注医疗的肿瘤学家、医生、统筹治疗的护士和社工。社工的工作可以用简单的一个词概括，就是社会心理。他们致力于解决癌症带来的心理影响，以及患者在社会生活中的影响。
那么心理辅导里面呢，就包括了对病人本身的心理的疗法，还有就是包括了对家庭整个家族的，比如说跟他的配偶啦，还有他的子女，我们说的是一个家庭的一个治疗。那还有一个治疗呢，就是非常重要的，或许大家也还不是太熟悉，就是说癌症病人的群疗。大家都患有不同的癌症的病人，他们做一个群疗小组的疗法，这个样实际上互相鼓励吧，用这个群疗的那个力量来帮助他们能够战胜，这个是非常有效的。
怎么样能够帮这个病人他得到身体上的舒适？病人可不可以被告知、被教育，而且有机会讨论出他想要的医疗方式？再来就是说，家庭里面如果有可能够把所有的所谓的不和，在这个时候能够解除，能够让病人有机会向家里人说，我其实是很爱你们的。对他的太太能够有一次跟他说，我真希望以后还能跟你做一辈子牵手。我想那是一件很美的事情。面对了末期的病人，你可以把身体的痛苦交给医生，你可以把灵性上的需要交给你所信仰的宗教，然后在于你对家庭的完整，应该能够快快的寻求一个最圆满、无憾的处理方式。
And we see people come in totally hopeless, scared, overwhelmed, not knowing what's going to happen or how to approach that. 90, 95, 97% of all the people I work with, by the end of our work, are filled again with hope and help.
Also, in terms of support, I had counseling provided by Cancer Care for a few months, which helped a lot with the transition, because it was hard to understand what I was going through and how to go forward. I just knew that my body wasn't working the way it used to.
释放心灵，洗涤疲惫，接受每一生的祝福，聚集每一个喜悦，这正是人生困境中的积极心态。但是因为中国人的传统观念，前列腺又是男性的敏感器官，亚裔前列腺癌症病患会有更多的顾虑，难以启齿。针对这样的文化背景的患者人群，又有什么样的方法可以帮助他们克服心理障碍呢？
确实就是说，亚洲的病人他们对性各方面都会比较保守，而且会觉得这个是不可以说的，他们觉得这个东西就是跟医生也不好说的，不好意思说。那要让他们知道，这个实际上是一个错觉，是一个误区。实际上呢，说出来疏通开来，实际上更加帮助他的恢复。
And one of my favorite metaphors when it comes to feelings is a tea kettle.If you fill a tea kettle full with water and you solder the lid shut and you put it on an open flame, what happens? It either explodes or implodes. And it's the same thing with our feelings, whether it's afraid of telling our families about our concerns, whether it's anger, whether whatever it is. Tea kettle works very functionally and effectively if it's got a hole.And the steam comes out gradually. So therapy, a lot of times, helps people to find a way to vent, to let out some of those pressures that they feel they can't share within their family and their social environment necessarily. But it brings them then to more clarity of mind in a safer place.
实际上有很多的病人呢，在忧郁的时候，他会用戒酒浇愁，他会去喝酒。那实际上这个是一个不良的习惯， 它只是得到了暂时性的缓解。酒精本身的化学成分会令一个病人得到更多的那个危险性的忧郁症，所以说酒啊、烟啊这些我们都不会主张。当然就是说家庭的配合非常重要，尤其是配偶的配合。男性他会觉得他这方面的功能在下降，他会觉得自己作为男性的一个标志已经没有了，他会觉得自尊心受到很大的伤害。在这个情况下，如果配偶的理解或者配偶的安慰，那就会对治疗帮助很大。
Take very good care of yourself. Ask for what you need. Ask for everything. Ask for more than you need. And the fear is real, but fortunately these days, prostate cancer, it's not deadly. It's usually very confined cancer and can be treated, can be eradicated. And if you can ask for support, get it. I hope they can trust their doctor, and you don't have to live with that, and you certainly don't have to die with it. And it comes down to that. You don't want to die of embarrassment.
以上介绍的药物治疗、综合治疗、心理治疗以及饮食辅助等多方面的治疗手段，的确给前列腺癌病患带来了希望。而且很多案例证明，这些所谓的绝症并非人们想象中的可怕。
I have a patient who's 96 years old. Some people think, well, you're 96 years old, you know, what else can you do? But in truth, this man was a man who used to work every day. This was from a few years back, and he was very, very active. And so when his cancer started to progress and he started to have symptoms, I decided to go ahead and treat him. And I gave him first hormonal therapy, of course, but later when his cancer started to grow again, I gave him additional treatments, low-dose chemotherapy, and then subsequently radium-223. And in each case, his symptoms and his quality of life really improved dramatically. And so even though he was quite elderly, and I was able to do so with very few side effects from the treatment, if you're careful and you adjust the doses properly and you give them the right treatment for that particular person's medical situation, I mean, these drugs offer many, many options for patients.
是一个男性，他得了前列腺癌，有一段时间确实有精神的变化，他甚至已经出现幻觉，但是呢，他也知道精神的力量非常重要，所以他也挺配合的。那么家人也很配合。他会把他治疗的反应、对药物的反应和自己的想法都能够跟我们沟通。那么在这个情况下，他现在这个前列腺癌已经有1年了吧，他挺好，各方面都比较稳定，更有信心。我看他的脸色也越来越好，他每一次来越来越开朗。当然，这种幻觉也已经消失了。
I don't feel that the cancer is something I did. I don't feel it's something I created. Well, I'm done with the cancer. One thing about this is I don't want to compare myself to other people. It simply doesn't apply. Of course, I've heard what's happened to other people, and they bounced back 100% or 90% or physically to myself. I do take care of myself. I do eat well, sleep, I rest. And rest is probably the most important thing I can do for myself. I want to feel empowered.
I've been in I've seen a tremendous amount of change in the prostate cancer field. It's a very, very exciting time. Our knowledge of prostate cancer is increasing. The number of new drugs has gone up significantly. What we can do for patients has gotten much, much better, and patients are living longer and better. So I would say to patients and their loved ones who are dealing with prostate cancer that there's a lot we can do. So do not be afraid of the disease.
这是一个中国的一个俗语，我想可以用它来总结。精神爽，百病消，就是说，当你一个人精神各方面都非常正性的话，比较积极的话，那我觉得你就会给自己带来一个比较正面的一个氛围。那么在这个氛围上，不知不觉你会觉得很多事都迎刃而解了，然后会觉得很多事都不是一个问题了。那这样的话，或许会给你带来很大的益处。
是的，人生有太多的变幻，如果无法逃避疾病的来临，我们可以选择面对疾病的态度，坚强、乐观，还有积极面对。现代医学的进步表明，很多癌症并非不治之症，战胜癌症的例子数不胜数。握紧生命的希望，奇迹就会发生。希望本期的健康1+1节目能给晚期前列腺癌病患带来帮助。我们下期节目再见。